Welcome to my presentation on generalized anxiety disorder. Hopefully it won't be too boring for you. My hope is that throughout the presentation you'll just gain a better understanding of what generalized anxiety disorder is, how to spot some of the signs, what to do when you're in the schools, and potential interventions and preventions that can hopefully help. And I'm going to start out by showing you two clips. They're pretty short from a movie on the next slide, and they're from Finding Nemo.
First day of school! Wake up, wake up! Come on, first day of school!
No, I don't want to go to school. 5 more minutes.
Not you, Dad, me!
Okay.
Get up, get up! Time for school, time for school, time for school, time for school!
All right, I'm up. It's time for school.
Whoa!
Nemo!
First day of school!
Nemo, don't move! Don't move! You'll never get out of there yourself. I'll do it. All right, where's the brake? You feel a brake?
No.
Sometimes you can't tell because fluid is rushing into the area. Now, any rushing fluids?
No.
Are you woozy?
No.
How many stripes do I have?
I'm fine.
Answer the stripe question.
3.
No! See, something's wrong with you. I have 1, 2, 3. That's all I have? Oh, you're okay. How's the lucky fin?
Lucky.
Let's see. Are you sure you want to go to school this year? Because there's no problem if you don't. You can wait 5 or 6 years.
Come on, Dad, it's time for school.
Forgot to brush.
Oh.
Do you want this anemone to sting you?
Yes.
Brush.
Okay, I'm done.
Up, you missed a spot.
Where?
There. Right there. And here, and here. All right, we're excited. First day of school, here we go. We're ready to learn, to get some knowledge. Now, what's the one thing we have to remember about the ocean?
It's not safe.
That's my boy. So, first, we check to see that the coast is clear. We go out and back in. And then we go out and back in. And then one more time, out and back in. And sometimes, if you want to do it 4 times.
Dad.
All right, come on, boy.
Dad, maybe while I'm at school, I'll see a shark.
I highly doubt that.
Have you ever met a shark?
No, and I don't plan to.
How old are sea turtles?
Sea turtles? I don't know.
Cindy Plankton from next door, he said that sea turtles said that they live to be about 100 years old.
Well, you know what? If I ever meet a sea turtle, I'll ask him. After I'm done talking to the shark, okay? Whoa, hold on, wait to cross. Hold my fin, hold my fin.
Dad, you're not gonna freak out like you did at the petting zoo, are you?
Hey, that snail was about to charge. I wonder where we're supposed to go.
I'll pick you up after school.
So Nemo's dad, Marlin, has some obvious anxiety there. And later on in the film, Marlin's friend Dory tells him to just keep swimming, which is good advice. Unfortunately, for those who struggle with generalized anxiety disorder, this can be difficult to do. It's hard for them to just keep going forward, and it's hard to hear, oh, don't worry so much, it'll be okay, just stop your thoughts, don't be so negative. It's really hard, especially when that worry is pathological. And what this means is that people with generalized anxiety disorder are catastrophizing. So they're thinking of the absolute worst case scenario, and it's overwhelming, and it's pervasive, and it's constant worry. It's uncontrollable. It feels like their thoughts are going a mile a minute, and it's hard to stop that. And later on in the presentation, we'll get into some tools and some coping strategies that can be used to treat this. Worry, though, is really just a coping strategy. It's very unproductive and highly maladaptive, but it's a coping strategy. It's what people are doing when they're uncomfortable and fearful and think the worst is going to happen. And they do this because they're getting this negative verbal thought activity that's just constant. And so their worry is just a mental response to a perceived threat when there doesn't seem to be any solution, when they think, I can't possibly do anything that will prevent this worry from happening or this perceived threat from happening. And it's essentially a strategy also to avoid feeling badly. So you've got that effective reactivity that can happen, and people often will worry to sort of disassociate from that uncomfortable emotion, negative emotion they're feeling. And I like how the text points out that clinical worry is an attempt to avoid being surprised by negative events or a means to prepare for the worst. And it can feel like you're kind of got your mind in this hamster wheel. It's nonstop worrying, and you're just constantly trying to get away from threats that aren't even there. So in order to be diagnosed with general anxiety disorder based on the DSM-5, there are a couple criteria you need to meet. The first one is you must have excessive anxiety and worry. So, everyone worries to some extent, but the first criteria is it must be excessive. So it must be more days than not for at least 6 months. And it must be about a number of things, a number of events and activities. It can't just be maybe you're extremely fearful of snakes. It can't just be that, because that could essentially be a phobia. It must be about, school, relationships, day-to-day activities. And it also must be really difficult to control the worry, so you're unable to cope effectively with all the worry. Criteria C is that this anxiety and worry must be associated with 3 of the following. And actually for children, it's just 1 of the following, which I found interesting, and I'm wondering why. This is one of the reasons why generalized anxiety disorder is oftentimes overdiagnosed in children. I'm not really sure, the book didn't specify, but things to look out for is restlessness, feeling keyed up or on edge, being easily fatigued, difficulty concentrating, or mind going blank, and that's understandable if all you're doing is thinking about worry. Feeling really irritable, having tense muscles, and not being able to sleep well. The anxiety, worry, or physical symptoms must cause clinically significant distress or impairment. And also this level of worry cannot be blamed on, substance abuse, a medical condition, things like that. And it also cannot be explained by another mental disorder, for example, one of the other anxiety disorders, so phobia or separation anxiety or things like that. In terms of the prevalence of generalized anxiety disorder, it's really hard to pin down a specific number, mainly because of all the DSM criteria changes and variations in definition. But from what I gathered from the text, the lifetime prevalence seems to bounce around between about 3 and 8%, depending on which criteria you look at. And this is pretty similar across countries. Some also important socio-demographic features include gender. So women are 2 times more likely than men to have this. You're more likely to have this if you've been previously married. If you work inside the home, I'm wondering if this has to do with gender as well. And if you live in the Northeast USA. What I found really interesting, though, is things that are not associated with an increase in generalized anxiety disorder include ethnicity, education, religion, urban areas, and income. So I thought that was pretty interesting, because normally those things are associated with increases or decreases depending on what you're looking at. And then also, prevalence tends to peak around middle age, so you'll see a lot more diagnoses probably after adolescence, and then it'll eventually peak out. The median age of onset of generalized anxiety disorder is 30 years, and it rarely is diagnosed prior to adolescence, which I also thought was odd considering it's overdiagnosed in children. But anyways, most people, whether or not they're diagnosed, report feeling anxious and nervous their entire life, and these symptoms often occur early. So you're going to see this in childhood, and oftentimes people will report having an anxious temperament. What I found to be pretty shocking, actually, from reading is that generalized anxiety disorder is very, very chronic, and even though there can be fluctuations in symptom severity, so sometimes the person might have things under control, and other times it's just they're continuously worrying and on edge. full remission is very low. So I find that pretty shocking. I think it really makes it that much more important to, pour efforts into prevention and intervention methods. So the developmental course changes depending on your age, and again, the median age is 30, and it drops off around middle adulthood. But when you're children, you're going to have more physical worries, so catastrophic events, health worries. Adolescents can get both, but it's more psychological, so you're worried about your performance, your competence, being punctual. Adults also have that psychological worry, and it's often related to relationships. And when you're elderly, it's almost kind of back to the beginning again, where you have psychological worry, but also that physical worry. So a lot of times elderly are worried about their safety or cognitive impairment.